If your handwriting has gotten smaller recently, stop everything and watch this video. That is not just a quirk. That is not just aging. That could be a warning sign that your Parkinson's is moving faster than your doctors may realize. And what makes this so dangerous is that most people dismiss it completely. They think it is just stress or tiredness or getting older. But there is something happening inside the brain that this symptom is quietly revealing, and ignoring it can cost you months of valuable time. My name is part of the Beyond Parkinson community, and today I need to talk to you about something that most videos on Parkinson's skip entirely. Not the tremors, not the stiffness. Something more subtle, more hidden, and in many ways more telling. We are going to talk about the silent signals that your neurological system sends when Parkinson's is accelerating, why these signals are almost always misread, and what you can do right now to slow that progression down. Stay with me, because what I am about to share in the next few minutes could genuinely change the direction of this disease for you or someone you love. Let me introduce you to Gerald. Gerald is 68 years old. He was diagnosed with Parkinson's 4 years ago and doing reasonably well on medication. His tremors were controlled, his balance was decent, his family thought things were stable. But over about 6 months, Gerald started doing something strange. He started sitting down more. He stopped wanting to go to the grocery store. He got quieter at family dinners. His wife thought it was depression. His son thought he was just getting tired of fighting. His doctor saw him for 12 minutes, adjusted his medication slightly, and sent him home. Nobody connected the dots. Nobody saw what was really happening. Gerald was showing 4 specific signs that his Parkinson's was shifting into a more aggressive phase. And when his neurologist finally ran a full assessment, they confirmed it. The disease had progressed significantly in a window of time when the right interventions could have made a real difference. This is not a rare story. This is happening in homes across the country right now. And the reason it keeps happening is because the signs are not obvious. They are not the dramatic symptoms people expect from Parkinson's. They are quiet, they are easy to explain away, and they are extremely important. So what are these signs? And here is what I need you to understand before I explain them. The brain in Parkinson's does not lose function evenly. It does not decline in a straight line. There are phases of relative stability followed by windows of faster change. The research is very clear on this. Studies published in the journal Brain and journals focused on movement disorders have shown that Parkinson's progression tends to accelerate in waves, and those waves are often preceded by a cluster of soft symptoms that arrive weeks or even months before the bigger changes show up on clinical assessments. This is the window that matters. This is the window where intervention has the most power. And this is the window that most people miss because nobody told them what to look for. The first sign is a change in facial expression, not a dramatic, frozen face, not the kind of thing that shows up immediately in a photograph, but a gradual softening of emotional expression. People around you start to feel like you seem distant or unbothered or hard to read. Family members sometimes describe it as the person seems like they are checked out. What is actually happening is that the muscles of the face are beginning to receive weaker signals from the motor pathways affected by Parkinson's. This is called hypermimia. And while it is a recognized symptom, most people do not realize that a sudden increase in this flatness of expression, especially if it appears or worsens over just a few weeks, can be a marker that the disease is accelerating. If people who know you well have recently said things like "you seem different," "you seem tired," or "you seem far away," do not dismiss that. That observation from someone close to you is neurologically significant. The second sign is a change in the quality of sleep. Not just trouble falling asleep, not just waking up once during the night. I am talking about a specific change where the person begins acting out their dreams. They move during sleep. they speak, they kick, sometimes they grab or swing. This is called REM sleep behavior disorder, and in Parkinson's, it is not just a nuisance. Research from institutions including the Mayo Clinic and multiple European Parkinson centers has shown that worsening REM sleep behavior disorder often appears in a cluster with other signs of faster disease progression. The brain's ability to paralyze the body during dream sleep depends on the same brainstem circuits that Parkinson's gradually damages. When that symptom intensifies, it means those circuits are under more pressure. If you or a family member has noticed more frequent or more intense nighttime movements in recent months, that is a data point you should bring to your neurologist with urgency, not at the next routine visit 6 months from now. Before I go deeper into the other signs, I need to ask you something important. Drop a comment below and tell me this. Has anyone in your life mentioned that you seem different lately or that something is off, even if they could not explain exactly what it was? Write yes or no below. Because here is the thing, the people around someone with Parkinson's often detect these shifts before the medical system does. They do not have the vocabulary for it. They do not know what it means, but they feel it. Your community matters here. Your observations and the observations of the people who love you are clinical data. Do not throw that away. And if this is resonating with you right now, I want to invite you to subscribe to Beyond Parkinson. Every week, we publish content that goes beyond the basics, beyond what a 12-minute appointment can cover, and gives you the deeper understanding that actually changes how you manage this disease. Hit subscribe and then hit the bell so you see everything we put out. Now, the third sign, and this is the one that Gerald's family missed completely. It is a change in the speed and size of automatic movements. Not the intentional movements. Not the ones you think about and execute deliberately. The automatic ones. The swing of your arm when you walk, the blink of your eyes, the way your body naturally adjusts your posture when you shift your weight. These movements happen below the level of conscious thought, and they depend on brain circuits that Parkinson's progressively interrupts. When someone's arm swing decreases or disappears on one side, that is already a classic Parkinson's sign. But when it was present and then noticeably worsens over a short period of time, that is something different. That is progression. The same applies to blinking. People with Parkinson's blink less frequently on average, but a sudden decrease in blink rate, noticed either by the person themselves or by people around them, has been associated in several studies with a period of accelerated motor decline. And what about walking? Not falling, not freezing, but the subtle rhythm of walking. Does the stride feel shorter? Do the steps feel more shuffling? Is there a sense of being pulled forward slightly, like the center of gravity has shifted? These micro-changes in gait pattern, when they cluster together and worsen over weeks rather than months, are telling you something. The fourth sign is the one that most directly connects to what I mentioned at the beginning of this video: writing. Specifically, the size and the effort behind handwriting. There is a term for this in Parkinson's called micrographia. It is the tendency for handwriting to become smaller, and often the letters trail off and get even smaller toward the end of a word or sentence. This is not about hand tremor. People often confuse the two. Micrographia is driven by a different mechanism. It reflects the brain's increasing difficulty in generating and sustaining the proper amplitude of movement. When someone who had relatively stable handwriting starts showing noticeably smaller or more cramped writing over a matter of weeks, that is a sign worth taking very seriously. And here is what makes this particularly important. Writing is one of the few motor activities that produces a permanent record. You can go back and compare. You still have cards, letters, notes, grocery lists from a year ago, 2 years ago. Pull them out right now and compare them to what you or your loved one writes today. That comparison might be one of the most important things you do this week. Now, I want to be honest with you about something because honesty is what this channel is built on. Seeing one of these signs does not mean catastrophe. Parkinson's progresses differently in every person. Some people experience periods of what seems like worsening, followed by stabilization. Medication timing and absorption can affect how these symptoms appear on any given day. Stress, infection, dehydration, and poor sleep can all temporarily make Parkinson's symptoms worse without representing true disease progression. But here is the critical point. When you are seeing 2, 3, or 4 of these signs together, and when they are new or noticeably worse compared to a few months ago, that pattern demands attention. That pattern should not be explained away. That pattern should be the reason you call your neurologist this week and ask for a full reassessment, not the next scheduled appointment, not in 3 months, this week. And why does timing matter so much? Because the research on neuroprotection in Parkinson's is increasingly pointing in one direction. The interventions that slow progression, whether they are exercise-based, nutritional, pharmacological, or lifestyle-focused, appear to be significantly more effective when they are applied during windows of change rather than after the damage has compounded. A landmark study following over 1,200 people with Parkinson's showed that those who increased vigorous aerobic exercise during periods of detected progression had measurably slower motor decline over the following 2 years compared to those who continued their existing routines unchanged. Think about that. The moment of progression, the thing everyone fears, may actually be the moment where action has the greatest return. The brain is changing. That means it is malleable. It means the right input can shape what happens next, but only if you recognize the signal and respond to it. So what are the right inputs? What do you actually do if you are seeing these signs? First, you document. Write down specifically what you are noticing and when it started. Be concrete, not just, I seem stiffer, but I had trouble turning over in bed 3 nights this week, when before I could do it easily. Your neurologist needs specifics, not impressions. Concrete observations drive clinical decisions. Bring those notes to your appointment. Second, you move. I know that sounds almost too simple, but the evidence is genuinely powerful. High amplitude, rhythmic, whole body movement is the single best non-pharmacological intervention for slowing Parkinson's progression that we currently have. Not gentle stretching, not a slow walk around the block. We are talking about exercise that raises your heart rate, involves large movements, and challenges your balance and coordination. Programs like rock-steady boxing, dance therapy, cycling, and swimming have all shown compelling results in peer-reviewed research. If you are currently exercising, consider increasing both the intensity and the frequency. If you are not currently exercising, this is the most important thing you can start today, not tomorrow. Today. Third, you look at protein timing. This is something that often gets overlooked during conversations about progression, but it matters enormously if you are taking levodopa. Protein competes with levodopa for absorption in the gut and for transport across the blood-brain barrier. When someone's Parkinson's seems to be accelerating and their medication feels less effective, one of the first things worth examining is whether they are eating high-protein foods too close to their medication doses. This is not about eliminating protein. Protein is essential for muscle mass, immune function, and brain health. It is about timing. Many people find that shifting most of their protein intake to the evening meal, away from their daytime levodopa doses, produces a noticeable improvement in how well the medication works throughout the day. And better medication efficacy during a period of accelerated change can meaningfully affect outcomes. Talk to your neurologist or pharmacist about what protein redistribution might look like for your specific dosing schedule. Fourth, you address sleep. If REM sleep behavior disorder is worsening, your brain is not getting the deep restorative sleep it needs during a period when it needs it most. This is not something to manage with over-the-counter sleep aids. It requires a conversation with your doctor about specific interventions designed for Parkinson's-related sleep dysfunction. Some research has shown that low-dose melatonin and, in some cases, clonazepam can significantly reduce the intensity of REM sleep behavior disorder. Beyond medication, sleep hygiene for Parkinson's patients involves very specific adjustments that a standard sleep hygiene article will not cover. The sleep environment needs to be safe, given the possibility of movement. The bed partner needs to understand what is happening and why, and the timing of medications relative to sleep needs to be carefully evaluated. Sleep is not a passive activity. During sleep, the brain clears toxins, consolidates motor memory, and regulates the inflammatory processes that affect neurodegeneration. Protecting sleep during a period of accelerated progression is a direct act of neuroprotection. Fifth, and I cannot emphasize this enough, you reduce your stress load. I know that feels impossible. When you are watching your symptoms worsen, stress is not something you can just turn off, but the physiological relationship between cortisol and Parkinson's progression is real and documented. Elevated stress hormones accelerate the very neuroinflammatory processes that drive the disease forward. This is not about attitude or positive thinking. It is about biology, and there are very specific tools that have been shown in clinical research to lower cortisol and reduce neuroinflammation in people with Parkinson's. Regular mindfulness practice, even as little as 10 minutes per day, has shown measurable effects in multiple studies. Tai Chi has strong evidence both for motor function and for stress reduction. Social connection, specifically spending time in meaningful conversation with people who know you well, has been shown to have protective effects on brain health in neurodegenerative disease. These are not soft suggestions. These are data-backed interventions that work better the earlier you apply them. I want to come back to Gerald for a moment. After his family recognized what was happening and his neurologist confirmed the progression, Gerald started a modified exercise program 3 times per week. His protein timing was adjusted, his sleep was evaluated and treated, and his family made a deliberate decision to increase structured social time with him, not because it was convenient, but because the research told them it mattered. 6 months later, his neurologist was surprised by how well Gerald had responded. Not a reversal. Parkinson's does not reverse, but a measurable stabilization, a slowing, a quality of life that had stopped declining and started holding steady. Gerald told his family that the most important thing was feeling like he understood what was happening in his own body. Not just reacting to symptoms, but understanding the signals and knowing how to respond. That understanding is what this channel exists to give you. If you recognize 2 or more of those 4 signs in yourself or someone you love, do not close this video and move on with your day as if you did not hear this. Take one concrete action before you do anything else. Schedule an appointment with your neurologist specifically to discuss whether progression is occurring and what additional assessment tools should be used. Write down every symptom change you have noticed in the last 2 to 3 months. Start or increase your exercise program today, even if it is just 20 minutes of intentional large movement. And subscribe to Beyond Parkinson's so that the next time we publish content about managing this disease more effectively, you are there to receive it. You have already done something important by watching this video all the way through. That tells me you are paying attention, that you are taking this seriously, and that matters more than you know. Parkinson's is not a passive disease, and it does not respond to passive management, but it does respond. It responds to the right information applied at the right moment. You now have some of that information. What you do with it is the part that changes everything. We will see you in the next video, and until then, take care of yourself and take care of the people around you.